Marian, thank you for the invitation to be here today. Let me first also express my condolences for the terrible accident that happened on the railroad some days ago. It's been tragic to also witness your collective grief. I've listened to stories, I've listened to reflections, I've listened to anger and sadness and cynicism on how we can avoid such a tragedy in the future. So let me then ask also for you to listen to me, because I have suffered a big grief too. Already in this year, being now the 7th of March, I've lost 3 friends to cancer. And may I therefore ask you to stand up today with me to honor my friends, but also honor your friends and your families and all who have lost their lives to cancer, who are now suffering from cancer, and that's because they are the reason we are here today. Please stand up just for a moment of silence, respecting them with the same honor as we did this morning for the other victims. Thank you very much. So this is my message today. Let's share that compassion that we show towards other victims from accidents for victims from other diseases, because it really feels not like a rapid crash, but a slow crash. For many of us, being a friend or being a relative, we are trying to support our friends and families who suffer from cancer, and we are on board that train with you. And we need to somehow build on that compassion and those feelings into the policies that we are talking about today, into the treatment, into the prevention strategies, into the curriculum, into the training of healthcare professionals, perhaps even starting at schools. And that's part of the health literacy message that I hope you will take home today, because you are the champions in my view. You are the ones that can make that change that is necessary. You are the ones that can ensure that we get a common language where we can talk about cancer and that we can make comfort to people who are suffering from cancer, but also their families, their communities, their workplaces, their managers who have to deal with how we can get on with them living with their cancer, or if they have to pass away. My 3 friends, they chose 3 different ways of dealing with their disease. One was a scientist. He turned into science. He joined all the clinical trials he could find in order to find some cure. The other one, she chose to go to India. For her, she went to another kind of paradigm, did not find the comfort and help in Western medicine, so she went to India, to Ayurveda, did meditation. She sent me a message and said, well, Kristine, if I could live here, I know I would live, but I can't live here without my family and my friends. And the third one, he chose to come to terms with the fact that he would leave us. He asked his wife to come home, and so that he could watch out of the window, look into the garden. And in his last days, he was able to be admitted to a palliative care service, and the wife was so pleased that she could get eventually the support. So health literacy is also about being able to listen to people's concerns and need, help them in the ways that they feel trust in, with the best standards of care that we can give them. So thank you, everyone, for being here today to try to improve the outcomes. Thank you.